Welcome to Digital Health Talks, where innovators and changemakers share how they're transforming healthcare through technology. Join Megan Antonelli, who will be shining a light on the good things happening in digital health.
Welcome to Digital Health Talks. I'm Megan Antonelli, CEO of Health Impact Live. Looking back at the EHR era, one of the loudest lessons was that clinicians weren't in the room when the technology was designed. And healthcare is still recovering from it. This time, with AI and virtual care reshaping every corner of clinical practice, something is fundamentally different. Nurses aren't just in the room, they are leading the charge. And that matters because nursing is the most trusted profession in America, a distinction that they have held for a quarter century, according to Gallup. When nurses lead the design, patients feel it. Care teams feel it, and outcomes reflect it. Today's guest is proof of exactly that. Tracy Breece is VP of Nursing Innovation, AI, and Emerging Technologies at Advocate Health, one of the nation's largest nonprofit health systems. She is a 25-year nursing veteran and a certified informatics nurse, an MIT-trained AI strategist, and the person inside Advocate who is building the hospital room of the future with nurses driving every decision. I am so excited to have her here. Tracy, welcome to Digital Health Talks.
Wow. Thanks, Megan. I am thrilled to be here today, thrilled to have this conversation with you. And first and foremost, I'm a nurse. So all of those good things that you just said about me, I love being a nurse. I love being a mom. I love being a wife. And I love advocating for nursing. And I'm thrilled and blessed to be at Advocate Health, serving alongside many nurses and many nurse leaders to making a difference for our patients.
Yeah, I mean, you've had such an amazing career, prior to Advocate being at Mercy, and now, Advocate is just taking the lead in so much of this innovation around nursing. And, but you started, as you said, as a bedside nurse, but then kind of got into the informatics and AI space. And, we talk to a lot of nurses here, and we have, a big audience kind of focused on, kind of getting into the technology and adopting technology. Share with our audience a little bit about your background and kind of when you realized, technology was, a big part of what you wanted to do.
Sure, absolutely, Megan. And I am a first generation nurse in my family. Healthcare was not something that I grew up saying, oh my gosh, I want to make a difference taking care of others. But I'm so glad that I did. How I chose nursing was in college. We're all poor, at least I was poor, and I needed to make money while I was moving through my academic journey. And I nannied for a nurse in the ED. And oftentimes she was like, oh, Tracy, you have such curiosity about what it is that I do and how I take care of patients. Have you thought about nursing? And I said, Jeanette, I don't know. Maybe. And so I thought long and hard, and I went to school, changed my major. And oddly enough, Megan, I was a television and radio major. Little known secret. Shh, don't tell anyone. All your listeners.
I can see it on how well you're composed on the show.
I switched to healthcare, and none of my credits transferred. So that bought me a fifth year of a bachelor's degree learning. But anywho, so I transitioned to nursing school, and the advent of the World Wide Web happened while I was in college. I remember this vividly. I sat down in the computer lab, and I'm like, what is this? I have a keyboard. Started typing away, just started asking questions. And I spent hours, literally hours went by because I was just continually curious about all the questions that were now at my fingertips on a keyboard. I didn't grow up digitally native. I grew up with encyclopedias if I needed to understand how to write a book report. So this thing at my fingertips now was amazing. And when I started nursing, everything was on paper. There was no technology integration. I was counting my drips to understand 125 then cc's an hour because patient safety has come along and it's now 125 mils per hour. And I learned very early on in my career in the health system I was working for they wanted to begin this transition of how can technology support nursing in practice. And one day, we had some guests moving down a hallway. I was working, taking care of my patients, and that team of guests asked me a lot of questions. A few days later, I found myself in the chief nursing officer's office going, oh my gosh, did I say something wrong? I was a nurse, a young nurse at that time, maybe a year or two into my career, answering questions for guests in the hallway. And she said, Tracy, we're getting ready to move through a very significant journey of medication administration, having computers and technology and pharmacy automation support how nurses deliver safely medications to patients. Would you consider joining this project? And that was my first project. I said, yes. Here I am, more than 2 decades in, as you identified in the intro, loving how technology can support and uplift nursing practice.
Oh, that's amazing. I mean, and really to have been sort of at the front line of all of this, right? And I think the lesson there is say yes, right? That's how you kind of can get into this. For so many now, and I think it remains the same when I look at young nurses today. Where that comes from. So what a great story. And, I think, as I said in the open, that what was implemented first around technology and now where we are today, a couple decades later, is an amazing thing to see. And so as you look through that, and obviously to the credit of that organization you were with, they got you involved early. But not every organization has done that. And I think there's lessons being learned, and we are seeing a change in that we're hearing about nurses being part of the governance committee, part of the workflow redesigns as AI is being implemented. But tell us a little bit about kind of your experience across different organizations and now how it, sort of is so important to get those nurses involved and what it takes.
Absolutely. And Megan, there's something that you just identified is knowing who our key stakeholders are in the workflows that we are attempting to transform. And in healthcare, it's patients, nurses, doctors, all of the support network behind the nurses and doctors that are delivering care, our respiratory therapists, our speech language pathologists, and the list goes on. And so the first thing of I would say, having the nurse at the table, if you are in the middle of transforming a workflow that involves the nurse. And I know it's really simple. When we think about project management and we think about that workflow mapping, I'm not sure that we have that right yet in nursing. When I talk to my peers across the country, we still have these aha moments. Oh, the nurse wasn't there. Oh, the nurse wasn't there. And the question that I asked was, in the very beginning, did we map out that workflow and then consciously make the decision, who's the key stakeholder? And so that to me pulls into why project management is good for a nurse informaticist and why it's good to have a project manager teach a nurse informaticist. We're constantly evolving who needs to be at the table. And if it involves the nurse, have the nurse at the table. How you go about that in the organization, and I would say that is a completely separate topic. But for us, what I would say is we have this methodology to identify who, beyond our patients, because that's what we deliver, who's at the center of this care transformation. And then we rely on all of us in a fusion team approach. That's a Gartner term. It's a personal thing that I absolutely love from our Gartner colleagues. It makes a whole lot of sense when we think about diversity, fusing in a team, solving a problem that links to your strategy. And again, if it involves the nurse, have us at the table.
Mm-hmm. Right. And as you said, or implied, I mean, it is harder to do. It is not just, inviting them in for that conversation, right? I mean, you're saying that it requires a project manager. It requires someone actually managing when in the time is right to bring those people in, those stakeholders in to make sure it happens. Because I think one of the other the other side of that is nurses are incredibly busy, the hours that they spend there. And I think when we get into even conversations around, sort of nurses at the forefront of innovation, it's hard. They can easily identify problems, but to get to the solving, takes time off of what you're doing on a regular basis. So let's talk a little bit about, about that, but really what it takes to kind of give nurses the time to be able to participate in this sort of innovation process.
Yeah. The heart of your question here is structure. What is your structure, and is that right to enable success? We are blessed at Advocate Health to have Betty Jo Rocchio as our Chief Nursing Executive, as well as Katie Barr as our Chief Nursing Informatics Officer. They have worked very, very hard to set up a structure that allows me and other leaders to tap into the right resource at the right time to ensure our strategy connects to our patient outcomes and our nursing outcomes. So for us, what I would say is, in absence of having a structure that allows for the fluidity and the matrix that you need in a very large organization like Advocate Health, we would fail. And that is something that we're doing really, really well. And it's thanks to those two leaders who are leading the way, one of our commitments in that regard.
Yeah. Well, that's great. And they're all both fabulous leaders.
Yeah.
In terms of a lot of, we innovate, we bring these technologies in to make the workplace better, right? Make things happen better, make the job easier, but they're not always perceived that way. And in an environment where, there's no doubt, sort of burnout and retention has been a challenge, how do you engage them in such a way that they recognize that, this is about improvements, not only efficiency and things like that?
Yeah, great question. So we have the leaders, we have the structures, and those structures include time away from the bedside to commit to the problems we're trying to solve. One of the things that I think we do well in nursing, and I think you've already identified it, is we know the problems, we know them, and no one better than those that are doing the work in the work environment know those problems. Where we have failed in the past as an industry is kind of throwing all of those problems on a board and say, we're going to tackle this, and we're going to tackle this, and we're going to tackle this. And then we sit back and we're like, well, did we accomplish anything? And because the strategy was missing from what it was that we were trying to accomplish. So getting nurses at the table in that structure for us looks like professional practice councils. It includes our nursing informatics council. It's going to where the nurses perform, if you are a nurse informaticist, and into the space. And not only the nurse informaticist, the leadership team, the data scientist team, the computer scientist team, our physician colleagues, come with us and let's observe. Because often we're going to learn more in that fusion team approach as an observer of nursing practice as much as we do when we listen and hear nurses about their practice. So in the past, we've had computer scientists and our partners in engineering. We're like, come with us. They're helping design workflows with us in good partnerships. I'm like, come with us, come to the hospital. When we go to the hospital, they have this awe moment about them because they're like, oh, and the light bulbs go off because they're observing nurses do their work. And they're asking nurses questions about what it is they might be engineering in computer science, and they see it a different way. So the structures of the councils and the fusion team that's there to support nurses go to where we do our work, and you'll learn a lot.
You're listening to Digital Health Talks. When we return, we'll continue our discussion on how technology is revolutionizing healthcare delivery. Stay with us to hear more insights on creating sustainable, patient-centered digital health solutions.
I think that's such a huge part of this. And I think watching, certainly from my perspective, at events and meeting so many startups and innovators who experience the healthcare system in their lane, right? And it's such a different, whether it's I had a sick family member, I'm a caregiver, I'm a patient. or I'm a technologist and I see these opportunities, or even from the payer perspective and I see these reimbursement opportunities. Healthcare is so complex that when you see it from only one lane and you don't put yourself, what sort of walk the walk in the shoes of the others, it's so hard to really build those solutions. But you mentioned kind of the hospital and how that is sort of on-inducing for them. And an advocate has done such an incredible job in terms of adopting technology, building hospital rooms of the future. Paint a little picture for what that does look like for our audience right now, and then maybe what you see coming in the next few years.
Absolutely. So Megan, I would say we are still learning and we are still emerging. And what we have learned with finding an environment with the workflows for our workforce, so our strategy in nursing, those 3 W's, empowered and enabled by technology. What does that look like for us? For now, we have been working on ambient documentation as a methodology to alleviate that cognitive burden, the administrative tasks. We have technology supporting our practice through virtual nursing. We have the ability to use enhanced data and analytics to understand, are we meeting and making a difference within the work environment for nursing? I'm not sure what your audience might be most particular in hearing about, but I'm going to stay in the ambient lane because I have a deep passion for what we're seeing related to those outcomes. And albeit emerging, we are early. We are not 100% learned in this area, but let me tell you about what we've learned. We have learned when we give back time, and we're saving approximately 19,000 clicks in the EHR every 7 days, which is about 2 hours a week in collective nursing time. Let me make sure, 2 hours a day. I said a week. Sorry, 2 hours a day with those clicks. So those 2 hours, what does that look like? When we walk the halls and we ask the team who's using ambient documentation, how's this going for you? This is qualitative data. How are you feeling with this? What if I told you I was going to take this away? We did a great pilot, and we are immediately presented with, please don't take this away. And I said, tell me a little bit more about that. And so for a nurse tech, this was her answer. Tracy, at 6:45, when I am ready to leave my shift and I am tired of a long 12-hour shift, I look around and I see those techs that haven't used ambient in the same way that I have. I'm ready to go home. Mm-hmm. They're running around trying to finish their documentation. I'm ready to go home. They tell you that they're more present with their patient. The documentation just happens. And my most favorite, and Megan, for all of the computer scientist folks and those that understand AI, my most favorite piece of feedback that was qualitative was the documentation knows me. The documentation is capturing what it is that I'm delivering in my practice to my patients. And I don't have to think about it anymore. I just get to take care of my patients. And why that isn't so important for our industry is there's been a lot of skepticism around is advanced forms of artificial intelligence helpful to the environment where nursing care is performed? And I'm here to say with our limited knowledge that we have right now with ambient, absolutely yes. Because we're seeing that in data. We're seeing that in the best place to care for nurses. And that technology is meeting the nurse where the nurse is practicing. Now, it's not all sunshine and roses. We've learned a lot, right? We've learned a lot. And the number one thing that we learned with this technology is we have a mirror. And that mirror now informs nurses, nurse techs. This is how you just practiced. This is how you take care of your patient. This is how you develop a rapport with your patient. Now, I only see it. So our partners that we work with, if you're taking care of your patient, Megan, and you've received the consent and they know what it is that you're doing, and you have this audio on listening to your conversation while you're performing care, that is only presented to you. I'm never going to see that. Only you are going to see that as the person taking care of the patient. And that's the mirror you get. So you get an immediate piece of feedback which we've never done before in nursing practice, on this is what just happened in that room. And we have a lot of learning around that. And notably, nurses who are practicing longer like to use this technology more because they've been practicing longer. This is about practice and how we uplift the art and science of nursing. And the younger you are in your nursing career, the more you're still building that confidence, the more you're still learning how to develop that rapport in the room with the patient. So that's one element of our room of the future that we've been focusing on, Megan, and we have a whole lot of learnings about that. Time savings, cognitive relief, well-being for the nurses and nurses techs, and allowing them to be more present for our patients. And our patients are telling us in our patient experience surveys that we're listening more.
Right. Which is exactly what you're looking to achieve in all of this. It's funny. I was just speaking with Mohan Nair. He wrote a book recently called Unreachable. And it gets at the sort of cognitive atrophy that could happen with AI. And the point he makes is the importance of hard learning and doing the hard learning first. So I think what you said about more experienced nurses appreciating it because they already see their voice, they see their practice reflected back at them, right? Whereas younger nurses may not, or less experienced nurses may not see that and need more kind of instructive and more of that hard learning. How, when you're working, across, generations and different experience levels, are you kind of implementing or recommending adoption? Is it different? And kind of the training of it all. It seems like, certainly you have nurses who are choosing to use it less or more. How does that work? What does that look like in terms of, in practice?
This is a great question. And I think when we started with technology, so I talked about my very first practice with pharmacy and medication automation, the advent of the EHR followed. And we didn't have a really strong sense in nursing practice what that was going to do for us. I think what we did at the time, if I can, reflect back in years of informatics work, is we transitioned one documentation method for another. If we do that today with the ability with this enhanced multimodal artificial intelligence, we're likely going to have some of the same experiences. So I say that because ambient documentation, conversational documentation style for nursing is not a replacement one-for-one for documentation. And it takes a heavy lifting around change management with human plus the support of artificial intelligence for me to deliver the care as the registered nurse. And so what we've learned, cognitive neuroscience. We have long studied implementation science, which is different than change management, which has a long history of understanding how to manage changes. But we've layered on, in addition to those two things, understanding cognitive neuroscience and adaptive leadership for our frontline nurse managers. That recipe, supported by human factors engineering, is where we have really highlighted two tracks of learning as we are scaling ambient across our enterprise. That track for a nurse and a nurse tech is not necessarily about the technology. Yes, we need to understand how to turn it on and use the phone and have the conversations with our patients on what it is that we're doing with assistance in our documentation. But it's really about restoring my practice and how I practice with my patients. That's where we're anchoring our training and education, regardless of which generation you might identify with. So it's all the same about recentering. Our purpose is uplifting the art and science of nursing, being a best place to care for nurses. So patients choose us and nurses choose and are staying at Advocate Health to practice. So that's the one side of training. the other side of training, so this is nothing about technology. The other side of training is, how do I, as a nurse manager, lead in this era of uncertainty? And so for us at Advocate Health, we have our 4 commitments. We have embrace the unknown, think boldly, lead the way, and lift everyone up. That's the invitation for nurse managers to align with where it is that we're going, to liberate ourselves into this space of let's do this together. That's the core of adaptive leadership. The absolute core is nurse managers. They've been known to have all the answers, to want to fix it. Well, in this era of leading the way and embracing the unknown, there's a lot we don't know. And so it's emerging as we go. And we're diligent about understanding what it is we're trying to accomplish. What are our outcomes? Who are our partners? Evaluate those outcomes together, pivot, and keep going. So there's not a lot of time to stay put, really.
Right.
And so our nurse managers, we give them tools in their toolbox. First, we start, because we don't want to assume anything about any singular person. We ask, where are you with your understanding of artificial intelligence? We gather awareness. But that's the first step of bringing the individual into the system of human plus AI. And then we do the flip side of it. We take the systems that are around us and bring that into the eye. So there's 2 cognitive neuroscientists activity, Dr. Maya Shankar and Dr. Caroline Leaf. And both of them respectfully study neuroscience in a different way. And we're equipping our nurse managers with a very specific exercise, starts with an awareness, allows them to liberate from what it is they are comfortable in their leadership style to embrace the unknown.
Wow. Tracy, thank you so much for joining us. What a pleasure to talk to you. I'm excited to see you again in person sometime at one of our events in the future, or at some of the bigger shows that you speak at often. So I appreciate it.
Megan, it's been a true delight. Thank you very much. And till we meet again.
Yeah. Give our audience a how they can follow, the work that you're doing in Advocate, or get in touch.
Absolutely. I'm on LinkedIn. So just hit me up on LinkedIn and I will respond.
Perfect. That's great. Thanks so much again to our audience. Thanks for listening. If this conversation sparked something for you, which I'm sure it has, hit the like and subscribe button and share it with your colleagues today. You can get a full library of our conversations with leaders at healthimpactlive.com. Thanks again. This is Megan Antonelli, CEO of Health Impact Live. Digital Health Talks, where operators do the real work that makes healthcare better for everyone. Until next time, let's keep fixing healthcare one conversation at a time.
Thank you for joining us on Digital Health Talks with hosts Megan Antonelli, Janae Sharp, and Shahid Shah. For more insights on healthcare innovation and a deeper dive into today's discussion, visit healthimpactlive.com. Join us next week as we continue exploring the technologies and strategies transforming healthcare.